Hey guys, I am Dr. Gretchen and I am a pelvic floor physical therapist with Breakfreept Pelvic Health and Wellness. And today I'm going to talk about Kegels, and that is what a lot of the general public thinks about when they think about the pelvic floor. And Kegels are a very small part of what the pelvic floor can do, and it's also a very small part of what we actually prescribe in pelvic floor physical therapy. So what a Kegel is it's a contraction of the pelvic floor. So the pelvic floor is a main muscle here called the levator ani, which connects from the front pubic bone to the back to the tailbone. So a Kegel is a shortening or a contraction of the pelvic floor where there would be a closure that occurs and a lift of the levator ani. There is a time and place to do Kegels, but you should always be assessed by a pelvic floor physical therapist with an internal exam to assess the strength of your pelvic floor and the muscle tone of your pelvic floor. A lot of times women actually have tightness of the pelvic floor where they would not be appropriate to do Kegels. And that would be in women and men that suffer with constipation, that have any types of pelvic pain, pain with intercourse, difficulty emptying their bladder, urinary urgency sometimes, and even urinary incontinence can be more from a tightness of the pelvic floor and not a weakness. So before you are prescribed Kegels or you start doing Kegels, see a pelvic floor physical therapist first, because there's a good chance that you don't necessarily need to do them, and if you are doing them, there is a high chance that you are not doing them correctly.